We know from evidence over many years now that poverty and mental health problems, for example, are very closely related, which means that people who live in poverty are more likely to have mental health problems, and those who have a mental health problem are more likely to slide into poverty. So this year's World Mental Health Day theme, which is on inequalities, is actually a very welcome thing, because it focuses attention on the fact that these social inequalities actually have a huge impact on mental health problems. And that if we are going to address mental health problems, then we need to also address these social inequalities. Let's take India context, last year's suicide data, for example, during the COVID pandemic. We know, for example, that people who died because of suicide, there was a huge number of people who were unemployed or who lost their businesses during the COVID time, which might be related to suicide. So that's a direct example of how social issues such as unemployment, financial distress, poverty might actually impact things like suicide, which do have a mental health component to it. So I think it's very important that we keep this in mind when we are talking about issues such as suicide, that it's not purely an individual issue, that it's about the individual being vulnerable to mental health problems or suicide, but that there are broader social factors which actually drive mental health issues as well as suicide in our country. Mental health problems as well as these inequalities affect all people in our country, whether they live in rural parts of the country, they live in urban parts of the country, whether they are young or they are old. And this is what we've seen with our various projects. So let's take young people, for example, young people in urban areas. And what we've seen last year, for example, with the schools and colleges not being available, that mental health of young people took a serious beating in some sort of ways. Let's take the other extreme, which is old people in rural areas. And what we know is that the old people in rural areas also suffered from isolation, loneliness, and the fact that their relatives who might be in urban areas could not visit them because of the COVID lockdown. And so these kind of issues actually impacted all of our communities. We have projects in urban areas as well as in rural areas. And at both places, we noticed these kind of changes during the last 1 year of the COVID pandemic. One of our projects is called Atmiyata, which means empathy or shared compassion. The Atmiyata project works in a rural area in Mehsana district in the state of Gujarat. And there we've realized that just helping people with counseling or linking them up with mental health services at the public hospitals is not enough. They also need help with social benefits, for example. So, our champions in the Atmiyata project will help people get various social benefits that the government may have provided for them. For example, disability pension, widow's pension. If there are some grants available for filling houses, then that's something that they help them with. So those are the kind of things that we do, because we believe that you cannot address mental health problem purely as a medical issue, but that it is something that is a psychosocial issue, which means you need to address the psychological aspects as well as the social aspects of the mental health problems. On the other hand, we also have a project called Outlive, which works in urban areas with young people for suicide prevention. And there the plan is to actually train peer mentors and peer counselors who might be other college going students, who can then help and assist other young people, their peers, who might be feeling suicidal or distressed due to some issues that are going on in their life at that moment in time.